Hello. Hello, dear friends. This is Dr. Jambukeswaran, PrepLadder's orthopedic faculty for you. So just give me a thumbs up sign that I am visible and audible clearly. Hello. Anybody kindly give me this thing? Am I audible? Yeah, Dr. Tube, hi. Dr. J, hi. Yes. Okay. Excellent. Yes, excellent. So you're telling yes. Okay. So we'll go ahead with ortho recall of our FMGE. One happy news is that, dear guys and girls, okay, when I saw the question paper, I was feeling very happy for you. Total number of questions are 8. All the 8 are within our video content and our YouTube content. All are asked. I think you definitely, all of you would have rocked. We'll straight away move on to the first question. Okay. So, a young patient, a young adult presents with a fractured neck of femur. What is the most appropriate management? See, fracture neck of femur usually happens in elderly, that everyone knows. The catch here is they had asked a question, young adult. That is the catch. Young adult. That's the catch. Okay, for young adult, what is the management? They had given 4 choices: external fixation, internal fixation, hemiarthroplasty, total hip replacement. 4 choices they had given. The thing that will tempt us is whenever you see fracture neck of femur, the answer that will tempt us is hemiarthroplasty. I think most of you would have got tempted with hemiarthroplasty. But the catch here is young adult. That's what they had asked in the question. Okay. So for an young adult, hemiarthroplasty, what do you mean by hemiarthroplasty? It is replacing the head and the neck. Acetabulum is patient's own acetabulum. Head and neck is being replaced with a prosthesis. The question asked is young adult. See, whatever prosthesis we give, the lifespan is only 15 years. It is only 15 years. After that, you have to do revision. You have to do it again. The question asked is young adult. So, as far as possible, we should try to conserve the original head and the neck. That's the idea. So, the best answer among the 4 choices for this question is internal fixation. I hope my girls and guys should have done it correctly. Yeah, Dr. J, B, right answer. Dr. Tube has given the right answer. Okay, Light of Apprentice have given the right answer. Divya Shri. Okay, so I feel very happy for you guys and girls. Your answer is right. It is internal fixation. You can do internal fixation in a young adult with fractured neck of femur by 2 methods. One, by using dynamic hip screw. In YouTube session, which I done last for FMGE and NEET, the same point I had discussed. Dynamic hip screw is primarily used for intertrochanteric fracture. This everyone knows. In young adults, for fracture neck of femur also this is used. So you can use either a dynamic hip screw or 3-point fixation. 3-point fixation. 3-point fixation means we will align the neck and head. We will fix it with 3 screws in the fashion of an inverted triangle. So this is called the 3-point fixation. This is called 3-point fixation. Okay. So yes, tricky question to light as a, yes, it's a tricky question, but not for our guys and girls. Okay. So all of you had already rocked. I feel very happy. Okay. So the right answer is that hemiarthroplasty is reserved for elderly people, especially age over 60 years. We will move on to the next question. Which ligament is tested in the following test? They had given a beautiful thing. Already we had discussed this. It is there in our YouTube session. See, look at that knee joint is flexed to 90 degree. This is the catch. Knee joint is flexed to 90 degree. That means the test and the examiner sitting over foot of the patient and trying to lift the tuberosity, tibial tuberosity like this. So the examiner is doing a test and this is called anterior Drawers test. Anterior drawers test. We all know it's a straightforward cake. Anterior drawers test is done for anterior cruciate ligament. Okay. For posterior cruciate ligament, the test is called sag sign or gravity sign. For collaterals and thing, it's a different test. It is not. So this is anterior drawers test. Suppose the knee joint is flexed only to 30°, then that will become Latchman's test. Both are great tests for anterior cruciate ligament. And yes, all of you, okay, Satvik, Adya, Drashti Patel, Plight, Sairam, everybody have answered it. Epic Zone, everybody have answered it correctly. Straightforward cake for you. Okay. I feel very happy for you guys. We'll move on to the third question. Okay. A patient presents with the fracture shown in the X-ray. Which nerve is most likely to be injured in this type of fracture? Obviously, this X-ray shows fracture shaft of humerus. Fracture shaft of humerus. Obviously, fracture shaft of humerus. Okay, this is, I can say, this is in the middle third. This is the middle third, where your radial groove is there. So obviously, the nerve that is damaged is, without doubt, it is radial nerve. There is no second thought. Suppose if the same fracture line is little distal here, this is called Holstein-Lewis. Okay, Holstein-Lewis fracture. This fracture will be called Holstein-Lewis fracture. In that also, radial nerve is involved. So there is, whether it is a typical Holstein-Lewis or it is a shaft of humerus, doesn't matter. Straightforward answer. The answer is radial nerve. Hope, see, all of you have already banged. Okay, Nadeem, Kavisha Singh. Okay, Thunderkash. Oh, what a name, man. Thunderkash, radial nerve. So, okay, so all of you had rocked well. And we will move on to the fourth question. A patient presents with a ring-shaped lytic lesion in the bone. Which of the following is the most likely diagnosis? The X-ray that is given is X-ray of a knee joint, and I am able to see a lesion in the upper tibia. I am able to see a lesion in the upper tibia. Okay, this is the most favorite site for that condition. And when you carefully zoom and see that X-ray, lytic lesion is surrounded by a sclerotic wall. Sclerotic wall. So, a lytic lesion surrounded by a sclerotic wall in the upper tibia, it is a case of Brody's abscess unless otherwise proved. So, the right answer is Brody's abscess. Okay. Ramlal Sharma, Denon. Okay. Hardcore movies. What a name, man. Hardcore movies. Okay, so all of you, doctor, have answered it correctly. So it is Brody's abscess. We all know Brody's abscess, it's nothing but a type of subacute osteomyelitis. Osteomyelitis is divided into acute, subacute, chronic. Subacute osteomyelitis, only three. Brody's abscess, Gary's osteomyelitis, Salmonella osteomyelitis. So this question is about Brody's abscess. Okay, typical site for Brody's abscess. Subacute osteomyelitis, you know why it is happening. The virulence of the organism is low or resistance. The immunity of the patient is very high. Either virulence of the organism is low or immunity of the patient is very high. It will end up in a Brody's abscess. Okay, so that is subacute osteomyelitis. We will move on to what is that? Nishant Yadav. Okay, right. Okay. His history, there was no fever. Prakar Singh has a doubt. In history, there is no fever. In subacute osteomyelitis, dear Prakar, in subacute osteomyelitis, there will not be any fever. In chronic osteomyelitis also, there won't be history of fever. History of fever, malaise, all toxic symptoms is present only in acute osteomyelitis. Okay, that is the explanation, Prakar Singh. By this time, I think you would have been convinced. See, whenever you see a lytic lesion surrounded by a sclerotic rim, and you see in the upper tibia where it is situated, it's situated in the metaphyseal area. It should be a case of subacute osteomyelitis. Okay. Yes. And ADYYY. One doubt. Why not ABC? ABC means aneurysmal bone cyst. Aneurysmal bone cyst. I will explain. ADYYY. That is the name you had given, man. Can you please tell your real name? Just I want to call you by. I don't know whether you are a guy or a girl. Please. What is the name of ADYYY? Huh? What is your name? Valley. Okay. Okay. So yes, a valley. So you see, you concentrate here. Aneurysmal bone cyst. I will explain. Okay. Okay. ADYY. Your name is ADI. Adi sir. Okay. Adi. Hey, Adi. You just listen, man. You see, aneurysmal bone cyst means aneurysm means it's huge, bulging. Okay. And the site for aneurysmal bone cyst, the common site of aneurysmal bone cyst and unicameral bone cyst is humerus. It can happen anywhere. But when you look at the X-ray, how it will be there, an osteolytic lesion will be there, and it will be breaching, and the cortex, it will be bulging. The cortex will be bulging. When you see this lesion, this particular lesion, it's an osteolytic lesion which is seen in the cancellous bone. It is not going towards the cortex. It is contained well inside the cancellous bone and in the metaphysis, surrounded by a sclerotic rim. So there is no second thought. This is a case of subacute osteomyelitis. It is Brody's abscess. Okay, good. We will move on to the next question. Okay, I think Adi will be satisfied now. Okay, yes. Oh, Adi, I am telling a boy. Hey, boy. Okay, okay, Adi. Right. You see, yes, a patient. Go to the next question. A patient was sustained a road traffic accident and presented with the following fracture. What type of fracture is this? Very obvious. I am seeing a fracture which starts from the greater trochanter. It is going towards the lesser trochanter, and the lesser trochanter is shattered into a piece, a small piece. So this is nothing but a comminuted trochanteric fracture. So the right answer is intertrochanteric fracture. Exactly a similar picture. Yes, very good. Shreya has answered well. Rahul has answered well. Kavisha Singh, every Kausalya, everybody has answered excellently. I feel very happy, man. Okay. So, Aryan Singh Medicine, all of you have answered very well. Excellent. This is a straightforward X-ray of an intertrochanteric fracture. The same X-ray, and I have given in our video Boyd and Griffin's classification. And when you see, this will be type 2 Boyd and Griffin. It's a similar picture. Okay. Yes. And the treatment for this, the best treatment for this is proximal femoral nail. The best treatment, because when you see here, no, this lesser trochanter is shattered to pieces. Lesser trochanter, you see, it is separated into many pieces. So the best management for this is proximal femoral nail. We will move on to the next question, dear friends. Yes. Next question is, yes, a 2-week-old infant is brought to the hospital by the parents, and the parents report a history of a single fall. But the X-ray reveals, this is the catch, multiple fracture at different stages of healing. This is the point. Multiple fractures are there and they heal at a different stages of healing. What is the most likely diagnosis? Is it osteogenesis imperfecta? It's an accidental fall. Is it a battered baby syndrome? It's birth trauma. See, 2 weeks old infant. Okay. So different age of healing. It should be a case of yes. Yes. Rohit has answered it correctly. Adi has answered it correctly. Okay. Hassan has answered it correctly. I feel very happy for you guys. Straightforward. This is a case of battered baby syndrome. Battered baby syndrome has two synonym, guys. FM book gives one synonym. Ortho book gives one synonym. This is called CAFE. CAFE's syndrome. CAFE's disease is different. That is infantile hyperostosis. This is CAFE's syndrome, otherwise called Silverman syndrome. So two synonyms are there. So luckily they didn't ask the synonym. Directly they are given battered baby syndrome. The point is, battered baby syndrome, usually because of overpopulation of children, and in our country, female children, many they don't like. The parents themselves, they will beat the children. They won't report it immediately. They will bring it little later, and they would have beaten at different times. So that will show multiple fracture at different stages of healing. It is battered baby. Okay, almost same age of healing, it is osteogenesis imperfecta. That is the difference. So the closest possible differential diagnosis for battered baby syndrome is osteogenesis imperfecta. Osteogenesis imperfecta, easily you can identify the baby. First of all, that the parents will be very, very anxious. They won't lie to you. They will bring the baby immediately. So you can see stages of healing. Multiple fractures will be there, but age of healing is almost similar. In battered baby, different. Number two, when you look at the sclera, if it is osteogenesis imperfecta, it will show you a blue sclera because of thinning of, because you know pretty well osteogenesis imperfecta is a collagen disorder. So the sclera will be thinned out. So when the sclera gets thinned out, the background of sclera, what is behind the sclera? UVL pigments. What is the color of UVL pigment? Dark blue. So the sclera appears blue. So a blue sclera with dental abnormalities, multiple fracture, same age of healing, osteogenesis imperfecta. No other things are there. Multiple fracture, different age of healing, especially a female child. Think of battered baby syndrome. Okay, we'll move on to the next. Yes, blue sclera, Kavisha Singh has given. Yes, excellent. You are read well, man. You are read well. We'll move on to the next question. Yes, look at the diagram. Injury to which part causes difficulty in dorsiflexion of the foot? Okay, so the X-ray that is given is a knee joint X-ray. This is your femur, this is your tibia. Here, this is your neck of the fibula. This is neck of the fibula. So whenever, when this belongs to what is they had given, it is B. Okay, so this is marked as B. Here, this is marked as B. So whenever there is fracture around neck of the fibula, what is the nerve that wounds around the neck of the fibula? It is your common peroneal nerve. Common peroneal nerve. So when common peroneal nerve get injured, what is the end result? Foot drop. When foot drop happens, patient cannot dorsiflex the foot. So among A, B, C, D, so which is near the, which is marked against your neck of fibula? The answer is B. The right answer is B. Yes. Aryan Singh, Ankit Kumar. Okay, so all of you have answered it very correctly. I feel very happy for you guys. I think this time, no, this is a Diwali season for you regarding ortho. All of you are banged. So far, no controversial answers are given. All of you are answering well. That means you have cleared the exam, man. I am damn sure you have cleared the exam. Yes. Coming to the last question, eighth question. An elderly woman involved in a road traffic accident presents with, you see, difficulty in breathing. That is dyspnea. Dyspnea. And altered mental status. That means mental confusion. Next point is mental confusion. Okay. What is the most likely diagnosis? Okay. Road traffic accident. That means high velocity injury. And they had given in the X-ray, this is shaft of femur fracture. Shaft of femur fracture. Straight away, the answer is fat embolism. The answer is fat embolism. Oh, Rohit Balekar, ortho bang, sir. Okay, 100 out of 100. I feel very good, man. Excellent. Okay, so it is fat embolism. Straight away. In our video and in our YouTube session, I had used the word called GERD's triad. GERD's triad. What is this GERD's triad? Dyspnea, mental confusion, petechial rash. Petechial rash. When GERD's triad is there, the diagnosis is straightforward. It is, okay, straightforward. It is your fat embolism. So all the questions are covered. Okay. So, oh, Validity doctor is telling, sir, tell me the PG questions, NEET PG question. NEET PG is coming on August 3rd. Hey, if I out that question now, I will be behind bars, man. How can I tell the NEET questions? Okay. And I am very confident, Valabi, I'm very confident. I'm telling you are going to bang NEET also. There is no doubt. Okay. So with this, no, I will just end up with a big thank you. I hope all of you would have done well. And sure, all of you will clear. There is no second thought about that. Thank you so much, dear friends.